Hello, Tennessee Voices viewers and listeners. This is David Plazas, the Opinion and Engagement Director for the USA Today Network Tennessee and the Tennessean. Today, I have the pleasure of having as my guest Julie Hamm, who's the new president of the Tennessee Nurses Association. Julie, how are you doing today?
Doing great. Thanks for asking, David. How are you?
I'm doing very well, staying healthy, thankfully. And your backdrop is one, it's a beautiful backdrop, and it makes me think about my days living in Florida near the beach.
Yes, I figure with all the rain going on out there right now, I needed something to pick my spirits up a little bit. But yeah, try to keep that bright, positive background going at all times.
Well, for those of you who are joining us, this is we recorded this on February 17th, when indeed in Nashville it was an extremely rainy and stormy day. But tell us, for those of us who are not familiar with the Tennessee Nurses Association, what is it that you do, and what, as your role as president, what is it that you do?
Yes, thanks for asking. So, brand new to this role, just picked up my official gavel and pen in October. And so just hit the ground running. As president of the Tennessee Nurses Association, we represent all 110,000 nurses across the state of Tennessee, and happily do so. Happy to be leading such a number one trustworthy group in the eyes of the public. And just trying to really hang in there through this pandemic. It's been an interesting ride this past couple of years, and on behalf of all the nurses across the state, just trying to keep everybody safe. We're burned out, we're on the front lines, but really trying to keep that thought in the center of our head of why we went into this and why we want to help the healthcare and the outcomes of the people across the state.
You know, it's almost 2 years since the pandemic was discovered in Tennessee, and you talked a little bit about the challenges for nurses, and in fact, they have been our essential heroes out there helping people before the vaccines and now afterwards, and we've seen these tremendous spikes with Delta and then the Omicron variant. Could you tell me what is the situation like for nurses on the ground, and what should people know to understand? Because sometimes people can feel so disconnected from that.
Right, exactly. If you're not on the front lines and you're not acutely in a hospital, it's kind of difficult to understand what actually is still going on the front lines. I think the best way to describe it is kind of like a makeshift, MASH unit. You're still dealing with all of your very sick patients that you have on a regular basis. And now we've thrown this very virulent virus in on top of all of that. And so it's made for a very overwhelmed and exhausted, really, healthcare system. And so it's really trying to navigate not only the sick people that you have normally, but then how do we take care of this influx of people as well who are getting sick with the virus? And you're right, with the wave of Delta, and then we get through that and we think, okay, we're good, we're moving on, and then here comes Omicron, and we just thought, wow, is there ever any end in sight? And so I definitely think overwhelmed and stressed is a little bit how all of our nurses are feeling right now, but we still get up every day, come to work, and try to make a difference, and hope that more and more people will get the vaccines, and we'll get over this and get out.
And one of the things that we've reported numerous stories about this over the years in the different USA Today Network Tennessee publications about people's reluctance to get vaccines, or thinking that they could get the vaccine once they're in the hospital. And what are the messages that you send out to your members and also the public when it comes to the seriousness of COVID?
Yeah, so the importance is always, and nursing has always been linked to the science and where the science is behind vaccines. And the 100% science behind it is we know it works. We know that vaccines work. We've seen them work. And we've seen people with the vaccines who even then still go on to get a case of Omicron that is extremely contagious, not be as sick. And so while people tend to point and say, we told you those vaccines didn't work, you got Omicron anyway. Yeah, but we did not get as sick and we did not go into the hospital. And that is the key indicator. And certainly we have found also with the vaccines, that those who got the booster are not getting Omicron. And so it's not only we needed a two-step vaccine, but perhaps we really did need that third shot to keep us from getting any other variant that comes along.
One of the things that has been a concern of me is the treatment by some people of healthcare workers, because in some cases, initially, everybody was hailing the heroism, but there's been some pushback as well to people. And I've heard of cases where some people in healthcare are concerned about even wearing their scrubs out in public because of threats. Have you seen that in this state?
I have not personally seen that in the state of Tennessee. The only thing that I have witnessed personally myself is maybe some skirmishes on not wanting to wear masks, especially in clinical areas where they are still advised, especially when you're dealing with sick people and in that area where there's a lot of stuff around. So a couple of things there, but usually when we mention, this is policy, and if you don't want to wear a mask, we're not going to be able to continue your care. Then they have a decision to make about what they want to do. But I had not heard that. I would be, it's kind of hard to go from the hero to that, right? I definitely would hope that's not helping happening to any of our healthcare heroes, no matter where they are along the spectrum, whether they're a nurse or not.
One of the things I also wanted to discuss with you is your recent guest opinion piece. And it was headlined COVID-19 pandemic highlights need to give full practice authority to some nurses. And we're in the beginning or relative beginning of the Tennessee General Assembly session. What is it that you're looking for from legislators?
Yeah, so I have, funny that you should mention that. I've been up on the Hill. Our Nurses Day on the Hill was this past Tuesday, and I have been at the legislature every day this week. So it has been a very busy week. We have really been working hard on our House Bill 184, Senate Bill 176, and this is our bill to really help access to care for Tennesseans. And what we're looking at with this amendment is our scope of practice does not change any. What we do as a nurse practitioner stays the same. So this is not an increase in our scope of practice. When nurse practitioners write a prescription, the state says that a physician must come behind us 30 days later and sign off 20% of those charts. And we know that this is an antiquated law that needs to go away. We understand that a physician signing off 30 days later, after we have already seen a patient and not in real time, is of no help to us at that point. You're not affecting any outcome. The patient has already been seen, gone home, and already taken 30 days of their prescription. So we were just asking for this contract, this piece of the legislation to go away. We still collaborate. Nurse practitioners are great at collaborating. We collaborate in real time with physicians and other colleagues of the healthcare continuum when we have a question, but we do it in real time when there's a question right then when we're seeing the patient. We really feel like, I read an interesting statistics today that said that 82% of Tennessee is considered rural. And that kind of struck home for me because another national study said in primary care that APRNs, which is nurse practitioners, would give about 72% of the care. So when you put those statistics together, 72% of APRNs are going to be the one to provide the care, and 82% of our state is rural. It's going to be APRNs that are providing the care in the rural areas. And we already know this to be true. We just would like for our nurse practitioners that are in those rural areas to not have to pay a doctor. And forgot to mention, there is a price amount on this physician. It's a contract. We do have to pay them for their services to come in and sign these charts off after 30 days.
Thank you so much for explaining that. And we've come to the midpoint of the discussion where I like to ask guests about what they've been doing for their own self-care. Leaders have a lot on their shoulders and sometimes don't take care of themselves as they should. So what are you reading, watching, doing just to help yourself and your own wellness?
Yes, I love that you asked this. I have a 9-year-old son, and my husband and my son and I are very active outdoors people. We like to hike a lot and just try to get outside whenever we can, breathe in that fresh air and kind of let the negativity out of our minds go and just enjoy the outdoors around us. Tennessee is just an amazing state with its hiking trails and beauty. I am a true crime fanatic and junkie, and I listen to Southern Fried True Crime podcast by Erica Kelly. Love her. And then I also read, it's so cliche, I'm sure, for some people listening, but I love JD Robb and some of her true crime stuff not true crime, hers is fiction, but it's based on true crime. And so I like to read her as well.
Well, thank you so much for sharing that. That's wonderful to hear. I want to get back to your origin story. So how did you become a nurse and what has kept you in the profession?
Yeah, so I became a nurse in 1999 when I graduated with my BSN in Memphis. When I was originally moved to Memphis, I was actually in a sales position, and it simply was one day, I guess you can call it an epiphany. I'm not sure what happened, but something, smacked me in the head and said, "Hey, what are you really doing to help people? You're selling stuff." And I just didn't feel like I was getting much out of my career. And granted, I had not graduated that long ago. And I thought, I just really want to be a nurse. And so applied thinking, we'll see if I get in. Got in. Next thing you know, I'm enrolled in classes, and then just loved it. Just loved learning anatomy and physiology, medical terminology, and just learning more about how the human body works and how you can work to really take care of it as well.
Thank you for sharing that. And the second part of that is what keeps you going after all this time? It's been over 20 years.
Yeah, a long time. I love my job. I love what I do every day. I love getting up. I love that every day is different. Every patient is different. And we nurse practitioners, I think, do a great job of treating the patient as a whole person and really working together with the patient to get the health outcome that they really want to achieve. And so I just love that it's something different every day.
Well, thank you very much for that. One of the things I wanted to ask you also was the issue of burnout and healthcare workers, because really this has been a very challenging couple of years. And from what I've read, obviously there's this great resignation that's happening that's affecting all industries, but I've heard a lot about people who are just done with that. And what kind of conversations are you having within your association about how to deal with that?
Yeah, we've unfortunately starting to see a lot of nurses leave the field, and this is very unfortunate. It's something we're going to have to address more as we move forward. I have seen several, social media, I think, is so powerful now, and I have seen several of these videos of nurses just in their cars, bawling their eyes out, crying, saying, they cannot go on and they can't do this anymore. And it breaks my heart because I think the key to breaking that is being able to reach out and talk to someone else, whether that be another nurse or a counselor or somebody that you can unload some of this on and be able to talk through it and understand why you're feeling the way you're feeling and you're so overwhelmed. I always talk to all of my nurses. I'm a manager, and I'm always talking to my nurses saying, "Hey, you guys okay? I'm always around and you need anything." And I just feel like we probably need to set up more counseling. We definitely need more recognition on what is happening, and an outlet for these nurses to say, "Hey, I'm really burnt out and this is why, and this is what happened." And I think we all know that therapy and counseling and talk is some of the best way to do that. And I think we're going to have to really invest in this for our nurses, and then certainly for our members of our TNA association.
Thank you very much. It's been very interesting as you talk to people who are thinking about a career in healthcare. What are the things you say as you look at the challenges? This is obviously a unique time. When you started, when I started in my business, there wasn't this pandemic, and you're in a situation where you're not always able to have the kind of close interaction that you might have had early on in your career. What are the things you say as to why you want people, or you would like people to consider nursing as a career?
Yeah, you can, like I said, you can really make a difference in people's lives. I know that's kind of sounds cliche, but it really, when you have taken a disease process, whether it be hypertension, diabetes, any of those, and you actually stop those for the patient and show them that they can actually put years on their lives, I think that that is rewarding. And I think you really have to take that in and grow off that and say, this is such a rewarding profession. Nurses are the number one trusted profession in the nation. And I think you just have to understand as a person, if you're going to become a nurse, that we just provide so much care to our patients. We're really the listening ear that they need, that they want to talk to. And it just inspires me every day to keep going. It's really the interaction between myself and the patient, of getting them to smile. They may be getting bad news. They may be coming in and they're not super happy to be at the hospital in the first place, but just trying to give them something positive, make them smile, and just have the interaction that turns out to be positive is what keeps me going every day. But I worry about new nurses coming in. But I think those of us that have that fire and that burn inside us to help people, I don't think it ever goes away.
Excellent. It's great to hear. I know people who are ailing certainly appreciate that. One of the things that I have studied quite a bit over the last couple of decades actually has been about just the changing trends in terms of aging, because our population is getting older. People are living much longer and are, because of age-related ailments, are needing care these days. And how do you see care, the continuum of care, evolving over time? We know that people who are really sick, need to go to a hospital, but sometimes that may not be necessary.
Yeah, we're doing such a good job of preventive care these days, right? Like you get your preventive exams now and you go see your doctor before a problem really gets out of hand. And I think we've shown how preventive care can really help. But to also talk on that same line as far as continuum of care, I also worry our population of nurses is aging. And we've got to be able to recruit and get that pipeline in of new nurses that are going to sustain us for this longer care continuum. And so I worry about our population as a whole aging, but also our nursing population aging.
Well, thank you very much for this. This has been such a pleasure to talk to you about your career and also about your words of wisdom, which I'm going to ask you about to elaborate on in just a little bit moment. But again, for the audience, this is Julie Hamm, the new president of the Tennessee Nurses Association. Congratulations on your new position. And again, before I let you go, I always like to ask guests if they would leave some words of wisdom to help the audience get through this challenging time.
Yes. Wash your hands, wear your masks if you're in crowds, and get your vaccines. And by all means, do whatever you can to stay healthy.
Well, thank you very much again, Julie. I appreciate you, and I hope you stay well and healthy. And I'm grateful for your time here on the Tennessee Voices podcast.
Thank you, David. Same to you. Stay healthy.
Thank you.